Have you been looking for examples of the best myofascial release or the best deep tissue work on the hip flexor, or also known as the psoas major? Well, I'm going to show you some examples of how we do it today on someone who has tight hip flexors.
Now, myofascial release is treatment of the muscles, fascia, tendons of the hip flexor, and in this case we're going to find the hip flexor, which is going to be right on the inner part of this bone right here called the ASIS, or it's the front part of the hip. You slide almost in like that and you can almost cup it. Make sure that when you do this on yourself or you're doing it on somebody else, don't have pointy fingers. Pointy fingers are really uncomfortable. So in this face up position, we can basically have our leg slide out while we're applying some pressure just on the inner part of that bony part of the hip, quote unquote, again the ASIS. So I like to do this a few times, and if I'm treating somebody, I like to back up my hand contact, again using flat fingers. It's extremely important. Now keep in mind, as we spoke about earlier, that if you go inward too far, there are vein, artery, and nerve there. Now I'm going to show you on the other side, just so you can see how much pressure I have, my hand contacts, and I'm going to find that bony prominence over here as well, and kind of sliding in. And again, this is a really tender, sensitive area on people, and I've never, ever recommended in person that anyone use any type of device on their own to get rid of hip flexor tendon issues. And keeping that in mind, I would strongly suggest going to someone who's experienced in deep tissue work. You could find a really good massage therapist. Again, there's good and bad of every type of profession. You can find a really good person, like a chiropractor, a PT who does active release is a great one. That is also called ART. Graston technique is another good one, as well as A-stem or instrument-assisted tissue work. So all these are possibilities of people that you can use. By the way, if you cannot find the tendon, you can press up, how I did, have her press up onto my hand. You can really feel the tendon pop up, and then you can really grab onto it and let her slide her leg down. Now the sideline technique is really good because we can actually use the fingertips even better to get in just like this. And what we can also get to is more hip extension. So I can bring her leg all the way back past neutral, which is what we can get on the table. But again, this is a little bit harder because you have to butt up against the person, make sure they don't fall off, because oftentimes they'll just roll back onto you. So we can extend the hip like that, keep pressure onto the psoas or iliacus area, and then get a little bit deeper into the area. Again, sometimes people like to hyperextend if they don't feel comfortable with you moving them, which is not what we want. So you need to sometimes keep them locked down on the table really well. And getting higher onto the psoas belly is really tough. I've had patients ask, like, can you get to the belly of it? I don't think so. It's way deep back there. So I like to focus on the tendon and stuff more towards the groin area.